Let's dive right into this whole weight management medication thing.
Okay.
You've probably heard a lot about Ozempic, right?
Yeah, all the buzz.
It seemed like it was everywhere, but GPs couldn't prescribe it for weight loss here.
Right, that's right. Semaglutide.
In the UK.
Yeah, the generic name for Ozempic Nice only recommended it for weight management in secondary care.
Okay.
So a lot of patients had a long wait to get it.
Yeah, I can imagine. And now there's Tirzepatide or Mounjaro if you prefer brand names.
Yeah.
Things are getting kind of interesting. For starters, NICE has approved it for GPs to prescribe for weight management in adults.
Yes.
Alongside diet and exercise, of course.
Of course.
Yeah.
Always got to have that healthy lifestyle.
This is a pretty big deal, isn't it?
It's potentially huge.
This could really change things for people struggling with obesity.
Yeah, for a long time, the options for treating obesity in primary care have been very limited.
Right.
So now GPs have another tool
Mm-hmm.
and potentially a much more accessible one.
Okay, so it's not just a free-for-all prescription.
Oh, no, definitely not.
Tell me more about what NICE says about who qualifies.
So a NICE recommends Tirzepatide for adults with a BMI of at least 35
Okay.
or 32.5 for people of Asian, Chinese, Middle Eastern, Black, African, or African Caribbean descent.
Okay, so there's some ethnic adjustments there.
Yeah, there are some adjustments in the guidelines, and importantly, they also have to have at least one weight-related condition,
Okay.
like hypertension or sleep apnea, to be eligible.
So it's not just about the number on the scale.
No.
You have to be dealing with the actual consequences as well.
Exactly.
Yeah.
You have to see the impact on their health.
It makes you wonder, though, if someone is already experiencing those kinds of health issues, are we intervening early enough?
That's a really important question.
Yeah.
And I think it's one that we'll be grappling with more and more as these new medications become available.
Right.
It really challenges how we've traditionally thought about weight management.
For sure. Absolutely. And NICE has even added a stopping rule?
They have.
What's that about?
So if a patient hasn't lost at least 5% of their initial weight after 6 months on the highest tolerated dose, NICE says it's time to reassess whether to continue treatment. So it really emphasizes that this is not a quick fix. It's about carefully weighing the benefits and the risks for each individual.
So no magic bullet,
Right.
but certainly a powerful new option, it seems like.
Yeah, it seems to be.
For those of us who don't spend all day, reading medical journals,
Yeah.
can you give us a crash course on Tirzepatide? What is it and how does it actually work?
So Tirzepatide is what's known as a dual GSP and GLP-1 receptor agonist.
All right, hold on. You're going to have to break that down for me.
Okay.
What on earth does that even mean?
Well, think of GIP and GLP-1 as two natural hormones that help regulate your blood sugar and appetite.
Okay.
Tirzepatide essentially mimics their actions,
Right.
but in a much more powerful way.
So it's like boosting what your body's already trying to do.
Exactly. It's like having a two-pronged attack on hunger.
A two-pronged attack. Okay. You've got my attention.
All right.
Tell me more.
So first, it enhances insulin secretion, which helps control blood sugar levels. Secondly, it slows down how quickly your stomach empties,
Okay.
which makes you feel fuller for longer.
Makes sense.
And it doesn't stop there.
Yeah.
It also acts on the brain
Oh, wow.
to suppress your appetite and increase feelings of fullness.
So you're really hitting it from all angles.
Yes, you're tackling hunger from multiple directions.
That's pretty impressive. But the question everyone's asking, I think, is it actually better than semaglutide?
Yeah, that's the big question, isn't it?
Everyone's heard about these incredible results people have had with Ozempic.
It's a good question, and it doesn't have a simple answer. There's a lot of excitement around Tirzepatide, and for good reason. Clinical trials have shown that it can lead to even greater weight loss than semaglutide.
Okay.
We're talking about potential weight reductions of up to 20% with Tirzepatide,
Wow.
compared to around 15% with semaglutide.
That's a significant difference.
It is.
For someone carrying, a lot of extra weight, that could be life-changing.
Absolutely.
Are there any other advantages to Tirzepatide?
It seems to have an edge in terms of glycemic control as well,
Okay.
meaning it's better at lowering blood sugar. And early studies suggest it might also have a positive impact on lipid metabolism.
So it could improve cholesterol levels.
Exactly,
Oh.
which is a big bonus for overall cardiovascular health.
So it sounds like Tirzepatide is winning this head-to-head.
Not quite.
Oh.
Remember, everyone responds differently to medication.
Right.
Some people may experience side effects with Tirzepatide.
Like nausea we hear about.
Yeah, like nausea, while others might tolerate semaglutide better.
Okay.
So it's about finding what works best for the individual.
You're right. It's never one size fits all. And let's be realistic. Even though NHS has given the green light, actually getting tirzepatide prescribed on the NHS is a whole other story.
Oh, absolutely. That's where things get a little more complicated.
And expensive.
Expensive.
How expensive are we talking?
Yeah. NHS England has estimated that implementing the NICE guidance could cost over £20 million per year.
Wow. That's a huge amount of money. And on top of that, are there any other logistical challenges that are causing them to maybe pump the brakes a bit?
Yeah, they are definitely approaching it with some caution.
So NICE approves it, but NHS England is hesitant. What's the holdup?
They're not rejecting it outright.
Oh.
They recognize the potential value, but it's not as simple as just making the medication available.
Right.
There needs to be a proper infrastructure in place to support its use.
You're saying it's not enough to just have the drug.
Right.
We need the systems to actually deliver it effectively.
Exactly. We need to think about the practicalities.
Okay, what kind of practicality?
Where, for example, weight management services aren't routinely commissioned in primary care.
Right.
So we need to develop sustainable service models that can deliver these treatments effectively.
And that takes time and resources and planning.
Absolutely.
What other challenges are we facing?
Well, healthcare professionals need training to prescribe and manage tirzepatide appropriately. Then there's the question of equity of access.
Right.
How do we ensure that everyone who could benefit can actually get it, regardless of where they live or their socioeconomic background?
Right. We don't want this to become a treatment only available to those who can afford to pay for it privately.
Exactly.
Yeah.
And then there's the potential strain on existing resources.
Right.
Adding a new treatment like this could put a lot of pressure on already stretched services, especially if demand is high.
Sure.
We need to be prepared for that.
That sounds like a logistical minefield. What's the timeline looking like? When can we realistically expect to see tirzepatide being routinely prescribed in primary care?
Well, NHS England additionally proposed a 12-year implementation period.
12 years.
I know.
That's a lifetime for someone struggling with obesity right now.
I know. It's quite a long time. But NICE is pushing for a much faster rollout,
Okay.
aiming to get tirzepatide to a subset of patients within 3 years.
Okay. That makes a lot more sense.
Yeah, they're really emphasizing the need for a phased approach.
A phased approach. Okay. But how do they decide who gets access first? Who gets prioritized?
That's a great question. And to be honest, that's where things start to get a bit unclear.
So we're talking about this 12-year rollout.
Yeah.
Which honestly feels like a lifetime for someone who's struggling right now.
I know.
But NICE is pushing for a faster rollout for some patients within 3 years.
Yeah, for a subset.
How are they planning on doing that? Who gets prioritized?
That's where the specifics get a bit hazy.
Okay.
NHS England is still developing the guidelines on how they'll prioritize patients based on clinical need.
I see.
So things like BMI, other health conditions, how those conditions are impacting their lives.
Yeah.
All those things will be taken into consideration.
I can see how that would be a tricky process.
It's complex.
So many factors to consider. And we know that NHS England is also working on these service models for delivering tirzepatide. But from what we've heard, they're being quite secretive about what those models might look like.
They've been pretty tight-lipped.
Redacted.
A lot of that information was actually redacted from the documents NICE used to develop their guidance.
Redacted sounds a bit mysterious.
It is a bit.
Why all the secrecy?
It's hard to say for sure.
Yeah.
But there's been a lot of discussion and speculation about their plans.
Okay.
And some stakeholders are concerned that NHS England might be planning to rely too heavily on general practices to deliver these services.
And that would be a problem because...
But think about the workload implications for GPs.
Right.
We're already incredibly busy.
Yeah, for sure.
Taking on the responsibility for prescribing, monitoring, providing ongoing support for a new and complex treatment like this would add a significant burden to our already overflowing plates.
That's a good point. And not to mention the additional training we'd need.
Exactly.
To be able to manage these patients effectively.
Yeah, we need to be able to prescribe it safely and confidently, not just add it to our to-do list.
Exactly. And there's also the issue of equity.
Absolutely.
If we rely solely on general practice, will we really be able to reach all the patients who could benefit?
Yeah, that's a big question.
What about those in areas with limited GP access or who face other barriers to healthcare?
It's a real concern.
So relying solely on GPs seems like it could create more problems than it solves?
It might.
What are the alternatives that are being considered?
Well, there's been a lot of talk about developing specialized weight management services.
Okay.
either as standalone clinics or integrated within existing healthcare settings.
So dedicated clinics specifically for people with obesity.
Yes, exactly.
Yeah.
These clinics would have a team of healthcare professionals specifically trained in obesity management.
Oh.
Doctors, nurses, dietitians, psychologists, you name it.
Wow, a whole team.
And patients would be referred to these services for assessment, to start treatment, and for ongoing management of their weight and related health issues.
That sounds like a much more holistic approach
It is.
than just handing someone a prescription and wishing them luck.
It's about providing comprehensive care.
And it takes some of that pressure off GPs.
For sure.
We could still be involved in identifying potential candidates,
Absolutely.
offering initial advice,
Yeah.
maybe even monitoring some aspects of treatment. But the bulk of the specialized care would be handled by this dedicated team.
Right. It's about sharing the responsibility
Yeah.
and making the best use of everyone's expertise.
Makes a lot of sense. It sounds like a well-structured system.
Hopefully it will be.
But let's not forget about technology.
Oh yes, technology is key.
I keep hearing about digital solutions
Yeah.
and how they could help streamline the rollout of Tirzepatide.
Right.
What are your thoughts on that?
I think technology has a huge role to play here.
Yeah.
NICE has been very clear that digital solutions need to be part of the equation,
Okay.
and I completely agree.
Can you give us some concrete examples of what these digital solutions might look like?
Sure. Imagine online platforms or apps
Yeah.
that patients could use for education
Sure.
about obesity and its management, self-monitoring of their progress,
Right.
and even virtual consultations with healthcare professionals.
Interesting.
These tools could be game changers for accessibility and convenience.
Especially for people who live in rural areas,
Yeah.
have busy schedules, or just find it difficult to attend those in-person appointments.
Absolutely. And let's not forget the potential benefits for data collection and monitoring.
Right.
We need robust data to understand how tirzepatide is working in real-world settings,
Yeah.
to track its long-term impact,
Sure.
and to identify any potential safety issues that might emerge. Digital platforms could really help us collect and analyze this data
Okay.
in a much more systematic and efficient way.
So we're talking about a multifaceted approach here.
We are.
There's advocating for wider access. NHS England figuring out the funding and the logistics.
Yeah.
GPs facing these potential new responsibilities.
Yeah.
Right.
This exciting potential of technology to really revolutionize how we deliver care.
It's a lot to take in.
It's a lot to unpack.
It is.
But what I find particularly interesting is that NICE is planning to conduct a formal review of this whole implementation process
They are.
after 3 years.
That's right.
So they're not just setting things in motion and hoping for the best.
No, they're going to be checking in.
They're going to be checking in, making sure things are on track.
Exactly. They'll be analyzing the real world data
Okay.
on how things are being implemented, the costs involved, how many people are actually accessing treatment, and most importantly, the outcomes for patients.
Yeah, the outcomes. That's what matters at the end of the day.
Absolutely.
And they'll also be evaluating the different service models that are being tried out,
Right.
comparing their effectiveness, feasibility, and cost effectiveness.
Exactly. Seeing what works best.
They're really taking a data-driven approach to this rollout.
They are.
It makes sense given the scale of what they're trying to do.
Yes, it's a huge undertaking. Rolling out a new treatment like this across the entire NHS is a massive challenge.
It is.
And they need to be able to adapt and refine their approach as they go.
Absolutely. You're right. They have to be flexible and responsive
Okay.
to the data they're gathering.
It's a dynamic process.
Very much so.
So we've covered the big picture stuff, but let's zoom in on the practicalities.
Right.
What about the actual prescribing guidelines? What do we as GPs need to know about who is eligible for Tirzepatide right now?
Well, the NICE has laid out very clear eligibility criteria.
Okay.
We've already talked about the BMI requirements.
Right. At least 35 or 32.5 for certain ethnic groups.
Yeah. And the need for at least one weight-related health condition.
But are we talking about secondary care only at this point?
That's where things get a bit more nuanced.
Okay.
NICE has stated that integrated care boards, or ICBs, are required to fund Tirzepatide within 3 months
Okay.
for all patients who are already accessing specialist weight management services.
So if a patient is already engaged with a specialist service,
Yes.
for obesity, they can get access to Tirzepatide right away.
That's the intention. Yes.
Okay.
But it also raises the question of what happens to patients who aren't currently under the care of a specialist.
And that's a lot of people.
It is a lot of people.
Not everyone has easy access to those services.
No.
There are waiting lists.
Yes.
Geographical barriers. Many people might not even know that these services exist.
That's true.
And that's why NICEBs has also mandated that funding for tirzepatide must be available within 6 months of the final guidance publication for what they call a phased introduction of delivery to eligible cohorts.
Yes.
Basically, this means that ICBs need to start figuring out how to provide access to tirzepatide for patients who aren't currently seeing a specialist.
Exactly.
So this is where those interim commissioning policies and prioritization statements come into play.
Precisely. NHS England is supposed to be developing guidance for ICBs on how to prioritize patients based on clinical need during this initial implementation phase.
Right.
They're also tasked with outlining the service models that will be used to deliver tirzepatide to these patients.
It sounds like a potential postcode lottery.
It could be.
Will access depend on where you live?
It's a valid concern.
And what services are available in your area?
And one that NICES has acknowledged. They've strongly emphasized the importance of equitable access and have urged NHS England to ensure that tirzepatide is available to all eligible patients, regardless of their location or socioeconomic status.
It's a tall order.
It is.
Given the complexities of the NHS and the variation in resources across different regions.
It's a massive undertaking. But if they can pull it off, it could be revolutionary.
It could.
If you get this right, tirzepatide could fundamentally change how we approach obesity management in primary care.
It does feel like we're standing on the edge of a paradigm shift.
I think so too.
In how we treat obesity. Yes.
But there are still a lot of unanswered questions.
There are.
How will these new service models work in practice? Will they be effective?
Good question.
How will we ensure equal access for everyone who needs this medication?
And the big question, will tirzepatide live up to the hype?
Right.
Will it deliver on its promise to transform the lives of people struggling with obesity?
Only time will tell.
We'll have to see.
But it's a fascinating journey.
It is.
And one that we'll be following closely.
Absolutely. And for all of you listening who are excited about the potential of tirzepatides, stay tuned. This is just the beginning.
It's definitely a lot to unpack. So much is still up in the air.
It is.
The service models, the funding, the equity issues. But it's clear that this isn't just another new drug.
No, it's not.
This feels different.
It does.
Like it has the potential to really shift the landscape of obesity care.
I agree. And it's not just about the medication itself.
It's forcing us to rethink our entire approach to obesity, to look beyond that simplistic eat less, move more narrative.
Which hasn't really worked.
It hasn't been very effective.
We're starting to recognize the complexity of obesity.
Yes.
The interplay of genetics, environment, and individual behavior.
Exactly. And tirzepatide is pushing us to develop more comprehensive, holistic, and, dare I say, compassionate approaches to care.
It's about time.
It is.
So what can our listeners do to stay informed and involved in this evolving landscape? What should they be paying attention to?
If you're a GP listening, I'd say keep a close eye on the guidance coming out from your local ICB.
Okay.
They'll be providing specific details about how tirzepatide will be commissioned and delivered in your area.
So really get into the nitty-gritty of it.
Yeah, get into the details.
And don't be afraid to ask questions.
Please do.
Right. Engage with your ICB. Share your concerns.
Yes.
Advocate for the resources and support you need to implement this effectively.
Absolutely.
Yeah.
And for those of you who are patients, stay informed about the developments in your area. Talk to your GP about whether tirzepatide might be right for you.
Yeah.
And don't hesitate to advocate for yourself and your needs.
That's so important. It's empowering to know that you're not alone in this journey.
You're not.
There are so many people working to improve obesity care.
There are a lot of dedicated people out there.
And new treatments like tirzepatide offer real hope for the future.
I'm so glad you said that hope is crucial.
Yeah.
For too long, obesity has been shrouded in stigma and shame.
Absolutely.
We need to shift that narrative and create a space where people feel supported and empowered to seek the care they need.
I love that. So as we wrap up this deep dive into the world of tirzepatide, I'm left feeling both excited and cautiously optimistic.
That seems like a reasonable stance.
Excited about the potential this new treatment holds, and cautious about the challenges we still need to overcome to make it truly accessible and effective for everyone who needs it.
I share your sentiments completely. It's a time of great change and possibility in this field.
Yeah.
And we'll be here every step of the way, diving deep into the latest developments and helping you make sense of it all.
So keep your ears open, your mind's curious,
Yes.
and your voice is strong.
Oh.
We're in this together.
We are.
Until next time, stay informed, stay engaged, and keep diving deep.
Thanks for listening, everyone.